We've been seeing pretty amazing reversals and all that with their age. It's been really cool to watch age reverse and slow down and all that. It's probably like 70% women,
Okay.
30%
Yeah.
men. A lot of men are brought in by their wives. Women are just, I feel, more aware and more willing to treat themselves.
Some of the worst clients and tests are the firefighters.
I had some Parkinson's patient that professional baseball player lived on a
Yeah.
golf course.
Mm-hmm.
And I'm like, well, then we need to look at your pesticides and the kind of pesticides, but also on mold too came up.
Yes.
Clearing him all that. Now his brain fog's gone, his arthritis pains and stuff are going. There's a lot of hidden things. Even we have like a Western diagnosis, like
Yeah.
someone they'll give me, random letters. You're like, you know this? Like I'll have to look that up. I don't know what that is.
What if aging isn't about slowing down, but leveling up? I'm Dr. Isaac Jones. This is the Longevity Leaders Podcast.
Hi, I'm Dr. Ashley Beckman here with the Longevity Leaders Podcast, and I'm joined with Dr. Bright. How are you
Yeah.
today?
Did very good.
Good. So this is kind of fun because we're both doctors of Chinese medicine and in California,
Yeah.
right? And we also both have a passion for functional medicine, peptides, right? And integrating this all together.
Yeah.
So how did you get started in this?
It was a whole long path, I guess, there.
Okay.
I started with a lot of sports growing up, broke a lot of things, collarbone, both my wrist, right hand twice, fractured my back, ankle, a lot of stuff. So started going towards physical therapy, but got kind of bored with just working on a lot of professional Olympic athletes and just fixing knees and backs, stuff like that. I wanted to get deeper. So I was also really interested in hypnotherapy in high school. And so my mentors went to Sedona and they taught us some energy work and stuff like that. That got me more interested in the energy type of thing. So that's where I dove into the acupuncture side and finished with the master's. And then they came out with the doctorate a couple years later.
Yep.
And then finished that virtually online, which is just all research based mostly. And then dove into functional medicine. And then I do a lot of applied kinesiology and stuff too. So all the muscle testing kind of narrowed down some of those. So it's been a long journey. And every time I go learn a new technique, I see someone else doing something else that I think it looks really cool. And I'm like, what's that? And that's the next on the list to learn. So
Yeah.
yeah, it's been a good little rabbit hole I dove down, I guess. It's kind of leading me along the way.
So you've done also NAET.
NAET, NET, quantum neurology, contact reflex analysis, a lot
Oh
of the
yeah.
different
Yep.
ones, and then CPK is the
Yeah.
more recent one. So Dr. Jabin and stuff does that.
Yes. I was just
So
there.
you were you? I was just in Greece and then Ireland, so I just got back like the day before, so I didn't
Yep.
make that one. But yeah, I'm often. I didn't know there anyone else from California was there.
I was.
Yeah, cool.
Well, yeah. So it's really cool to, I think we're both on the same page where there's so many amazing modalities, especially weaving in the ancient medicine kind of theory and lens through which we look at people and constitutions.
Yeah.
And so besides you getting injured, did you have any other aspects of your health journey that kind of got you into the functional medicine side, like either mold or Lyme or?
No, I barely ever got sick. I
Oh,
always would get a warn like every 10, 15 years I'd get sick. I've had the flu once in 15 years.
yeah.
I tried to get COVID like 10 times from my girlfriend because she got it 8 times.
And you
And
weren't successful?
I couldn't get it. No, I
Ah,
just have a good immune system. So I've been fortunate in that way. I just haven't really been sick or anything. It's just more something that fascinated me. And I looked into like when I was just getting out of high school, things like cancer and vaccines and none of that was really making sense, like
right.
even through Western medicine. And so I figured there has to be kind of a better way to do this. And that's what kind of got me more interested in through holistic medicine and all of that. And I never grew up with holistic medicine. It was more went to the orthopedic.
Uh-huh.
Time I went to school and they asked for who's your doctor. I'm like, I don't know. It's usually my orthopedic that I saw.
Right.
It's usually breaking things, not getting sick. Like if you have to call someone, it'll probably be him.
Yeah.
But yes, I never really had a you know, I didn't experience holistic medicine until later in life. And so it just started something I started studying and researching and learning more about. And I'd probably talked to like 100 people that tried acupuncture
Mhm.
and had, 9 out of 10 of them loved it and had amazing results. So I'm like, well, then let me check it out and something more to it.
Did you
So
have pain from
I didn't really
all the
have any
injuries? No.
pain. No, I healed pretty well. So yeah, I'm
Amazing.
pretty resilient. I don't really get sick. I don't really have aches or pains. So sometimes it's hard when I come to these events and they have all these cool different modalities to
Right.
try out. And they're like, do you feel better? I'm like, well, I don't really have
Yeah.
pain to begin with. So it's hard to tell. I need to come more injured to some of these so I can test them out and see. Uh, But that's with a lot of these different techniques and different modalities and stuff. So I'll try it, I have all kinds of patients, and
Yeah.
my girlfriend too always has mold. She's a lot of mold issues, and she
Yeah.
loves tropical places. I'm not sensitive to mold.
Right.
Like when we were in Bali for a month earlier this year, all of our villas had mold in it
Oh, of course. Yeah.
and all that. And she, as soon as she walks into place, headaches and,
Hmm.
all that. I don't get as affected. Of course, over time, I probably would. And it did show up. I did like the Aristotle test here, and it showed mold and stuff on there
Mhm.
a few weeks after. So I was like, yeah, most likely. I just detox and stuff, but I don't really get the brain fog and low energy
Yeah.
and all that like she
You're
does.
resilient.
And she went to hypothyroid and everything from it.
Yep.
So we had to clear out the mold. We did some peptides for the thyroid and
Hmm.
it normalized her labs. Yeah, within 3 months.
So let's chat a little bit about peptides, right?
Yeah.
So what are some of the favorite ones that you're using at the moment?
I use the most BPC and TB500 for any
Mhm.
pains, injuries, BPC and KPV for any of the gut issues and stuff like that. People orally. I'll use some of the GLPs like retatrutide and stuff like that. Use a lot of the mitochondrial ones, SS31, MOTS-c, Humanin,
Yep.
especially for anyone after mold or any of my longevity ones going through mitochondrial portion of it. Alon as well for telomeres and longevity and boosting thymosin alpha be the other one for any kind of immune stuff. Just want to keep it home all the time. We did a few before we went to like Greece or out of the country just to
Yeah.
like boost your immune system so you don't get sick while you're traveling.
For sure.
Are
Are you still bringing
and then
like
the HGH ones
Yuping
too.
Fangsang or anything?
The what?
The Yuping Fangsang
Yuping
or anything?
Fangsang. I use some of them because I do feel like some of those formulas still aren't matched yet for like some of
yeah.
the things that we have.
Right.
So we do have some more advanced, supplements and things than we do. We could have golden thread before, and then berberine and dihydroberberine. We're kind of getting stronger and stronger to those, but still for like some of the conditions and things like Lua Diwang Wang or Guibitong or some of those I'll still use. I just don't feel like there's an equivalent to.
Right.
Yeah.
Those formulas were they were just very well thought out. And
Yeah.
I think it's so amazing to have that background on herbs because we just see herbs differently. It's not like, oh, this one's warm or cool. It's just like, oh, this goes to all these specific channels versus this. And
Yeah.
it's a really neat education.
Yeah.
For
That was
sure.
probably the hardest portion of me going through
Oh.
the doctorate program is
The herbs.
the herbs and the formulas. And then, of course, all the Chinese students like, that test was so easy. I'm like, no, it wasn't. They're like, well, which one's for the stomach? Obviously, the 5 stomach powder. I'm like, that's not what it says to me. Like, I was struggling pronouncing these words, letting me understanding what they all mean.
Yeah, we had to learn a
So,
whole new language.
yeah. And
And
so
then-
that was tough. But, yeah, definitely thankful for that education.
Do you still practice acupuncture?
Yeah, I do.
Okay.
And I do a lot of with like Jeremy Steiner and all the microcurrent type of stuff.
Okay. And then tell me a little bit about your longevity practices or what you implement in your clinic. I guess
Yeah.
besides the peptides.
So
Chatted about that.
the longevity portion goes through a lot of lab testing. We'll go through genetic tests. We'll go through like a Nutri-Eval, through a blood test through like Vibrant, and the True Age to see all the organs and all that. I'll put all that together. I'll run it through AI and stuff to help me out to kind of create a perfect plan for them based on a custom vitamin for all their nutritional deficiencies. And then we'll go through we'll address a couple of the 12 hallmarks of aging each month. So we'll go through clearing out some of the senescent cells. Then we'll start working on the telomeres and the DNA. We'll go through working on the mitochondria, boosting stem cells, and then using bioregulator peptides based on whatever organs systems are aging the fastest.
Yes.
So we'll kind of go through all that in about 6 months.
Nice.
And so we've been seeing pretty amazing reversals and all that with their age.
Yeah. So you're running the True Age again.
Yeah, I'll run the True Age
And
after
the
about
True
6
Age.
months and see how we're doing with
Mhm.
everything. And so, yeah, it's been really cool to watch age reverse and slow down and all of that.
And then, so those programs you have are 6 months, and then do people continue on, or do you?
Yeah, then we'll get into more
customize?
advanced things from there. So we'll start with a lot of the peptides for the first 6 months, and then we'll continue with some of that, but get some more advanced, whether we're going through EBU or getting, more into hyperbaric, getting more into some of the blood plasma exchange and stem cells and stuff like that.
Okay, so you do the TP.
I'll have
Where you are?
referrals and stuff for them, but
Oh,
I'll
okay.
set up their protocols and programs
Oh,
for like
nice.
what they're going to be doing.
Okay.
But I will get create their protocols, basically the best kind of diet for them based off their genetics and their nutritional deficiencies. Anything like genetically that they methylation and all that, the deficiencies through any of their vitamins through the Nutri-Eval, I'll just kind of help fill all of those and make sure they're just being optimized all the way through. And then focusing on, little bits, whether it's some peptides for the telomeres or peptides for the mitochondria, along with all the nutrients and stuff that they need for that. And be getting a lot of energy and, just feeling way better. I had some going through, big moves and stuff like that. And like, I couldn't have done this like 3 months ago
Right.
if I just didn't have that energy. But it goes for almost everyone that had mold experience. They're going to need to go through mitochondrial rejuvenation and all that after, because I just broke it down. Diabetes, any of these cancers, any of the chronic conditions, they need to really, really kind of focus on that aspect too.
If you're a medical doctor, nurse practitioner, chiropractor, or other health expert that's stuck in a broken system, there's a better way. The Freedom Webinar shows you a proven 5-step system to build a 7-figure virtual health practice, or how to modernize your current brick and mortar practice without the burnout. Learn to create high-ticket programs, automated income, residual revenue, and attract clients ready to work with you. Book your $1 million strategy session today by clicking the link in the description.
Are you seeing, is your client population more men versus women, or a combination, or how is it?
It's probably like 70% women,
Okay.
90%
Yeah.
men. And a lot of men are brought in by their wives and stuff like
Yes.
that. Women are just, I feel, more aware and more willing to treat themselves, where men are more,
Yeah.
we'll see how it is tomorrow. It'll go away eventually, and
Maybe.
tomorrow never comes. Yeah. It just, the men would probably end up being more chronic a lot of the times because they
Mhm.
wait so long.
Yes.
But
Yeah. A lot of the women in my practice say their husbands go in basically when they're on the stretcher in the ER,
yeah.
is when they decide there's something's wrong.
So in general, more women come, but and in turn, they'll send some of your husbands and stuff like that in. But mostly probably 70% women.
Okay. Do you work with kids?
Yeah. Yeah. I get a lot of kids too.
Yeah. So then you're running a lot of the toxin testing, right?
Yeah, I'll do toxin testing. I do a lot of the pike kinesiology and stuff, especially for
yeah.
the kids.
Mhm.
So I'm not taking blood tests or anything like that when they're young for
Right.
sensitivities or parasites and molds and all
Mhm.
that. Do a lot of muscle testing, or I'll do muscle testing with adults too and show they have mold. And I'm like, let's do a mold test and see how much you have. I mean, sometimes they have to do that, whether they're at an apartment or as some that are firefighters and they had mold
Yes.
there.
Oh, those are the
And
worst.
now we
Yeah.
have to like prove to your station that you have mold, and then we
Yeah.
have to test. And then they need, that documentation showing that they have the
Yeah,
mold.
the firehouses are really bad for mold. And then some of the worst clients and tests are the firefighters that I've seen,
Yeah.
just because of everything they're exposed to.
Yeah, and someone I just talked to, I'm like, well, firefighter, we just have to run this test and see. But also you have fire retardant probably,
Mhm.
along with all these other
metals
environmental
and
chemical.
plastic.
And then I had some Parkinson's patient, that professional baseball player, lived on golf course.
Mhm.
And I'm like, well, then we need to look at your pesticides, and the high on pesticides, but also on mold too came up.
Yes. Yep.
And so clearing him all that, now his brain fog's gone, his arthritis pains and stuff are going.
Mhm.
So there's a lot of hidden things. Even when we have like a Western diagnosis, like
Yeah.
someone, they'll give me, random letters. You're like, this? I'm like, I'll have to look that up. I don't know what that is, And
Right.
I'm like, oh, okay, it's caused by fungal mold issue. Then
Right.
we go into that. I just might not know your diagnosis, but I can find out what's causing it, or the root cause or something.
Exactly.
So, the TCM's been great with a lot of those system things and functional
Mhm.
medicine, and it's kind of like more advanced, but I still see a lot of the formulas and stuff in TCM still
Mhm.
being really valuable.
Yeah, it's amazing how many, or just how it manifests differently in different people, right? Like the mold and the metals could be more, or in pesticides like Parkinson's versus ALS versus,
Right. Lyme and
Lyme and RA and everything. It's really interesting.
a lot of mold, a lot of parasites. I don't see as much Lyme in California as like a lot of the Midwest and East
Mhm.
Coast doctors do. But a lot of parasites, a lot of mold
Mm.
all the time. And then the mold ones, tricky. They'll move out of one house that has mold and
Yeah.
into another. And they're like, I think this one has mold too. And it's tough. And then traveling
Right.
is also,
Yeah. If you
hard.
like tropical, or just,
Yeah.
I mean, a lot of hotels have
Like when we
mold.
went to Bali, I brought, Takasumi, and I brought
Yeah.
Scutellaria and Biocidin and all these
Mhm.
things for mold and binding and detoxing, just because I knew like
Yeah.
what
It's
it was going to be
inevitable.
like. Yeah. But it's, sometimes my girlfriend's like, I want something to wear them on my neck and just blows like fresh air. So I'm like, maybe we'll invent something like that one day, but it's tough when you're traveling in Airbnbs and hotels. You never know. She had a wedding in Dominican Republic, this nice hotel that had mold, and they tried 3 rooms. They all had mold.
Wow.
Especially I got to pick, the
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 least
least the
offensive.
worst.
Yeah.
Yeah.
It's
So
tough too because again, once you're sensitive, you're a little bit more
yeah,
sensitive. Like you're heightened to it.
I know. She jokes now. She's like, I walk into any room like a beagle and tell you
Yeah.
like if it has mold in it, pretty much, and she can.
Yeah, unfortunately, it's just hard to escape. Anywhere that has running water is
Yeah.
potentially problematic.
Yeah.
I'm sure like you have, I've had patients send me pictures at their Airbnb of visible mold,
Yeah.
and I was like, yeah, that's mold.
Yeah, I did
Maybe
when I
sleep in
that's
the
why I
room
took a
if you can't
photo. Is
leave.
like all that black stuff on
Yeah.
top of the air conditioning. If you can try to clean that if possible. But yeah, it was tough. Like everywhere we went there, you have air conditioning on blast always, so there's going to be condensation, humidity. And you walk in, you smell the mildew
Yeah.
smell everywhere. Yeah, it's tough. Just got the best you can do is mitigate it. And then, of course, there's unlucky people genetically that just
Yeah.
can't detox very well. All those poor methylators. And I do have like heterozygous for the methylation. So recently my homocysteine went up a little bit. So then I know to methylated vitamins and all that. And then, so yeah, I was just monitoring everything. And this last year I kind of went big and tried the Aristotle and all the different labs for myself just to test everything out too. And then hormones are a big one that I see a lot of people, check it when you're like 50 or something like that. And
It's a
it's
bit
like,
late.
well,
Yeah.
what was your baseline? How much have you changed? Or like, I don't know. Because all these Western doctors say, don't worry about it until it's a problem.
And now more and more men are very low in
Yeah.
testosterone in their 20s and 30s.
Half of what they were,
Yeah.
50 years ago. Yeah.
Yeah. So it is, and that's the thing that's tough. And that's what's nice about, at least when people ask us these questions, we're not questioning what they're either asking it because we see it over and over.
Yeah.
But their traditional doctors are like, you don't need that lab, not till you're 50 or whatever it
just
is.
pulling teeth, even asking for like the
Thyroid
antibodies for
panel.
the thyroid.
Or just
They said
anything
no. I'm like,
besides
what do you mean they said no? It
TSH.
was just a check mark they had to make. It's not coming out of their pocket for the lab. Like, I
Mm-mm.
don't understand why they just won't run some of these things.
And that is the most frustrating thing. And I would
Yeah.
say is that's the most common lab that I say, sorry, you have to pay out of pocket for this because your doctor, try, but they never
Yeah.
run them.
Like how couldn't be like more than $20 or something to add on there. It's
Yeah.
not. It's worth it because 80 like 90% of those hypothyroid or Hashimoto's.
Hashimoto's, yeah.
And then I wouldn't even start treating the thyroid. It'd just be working at the gut and finding what's going on in the gut and get you off gluten and all that.
Right.
Whereas, Synthroid has gluten in it and they're just trying to give you T4, the inactive hormone, try to yell louder and louder at that deaf cell that's inflamed. And yeah, it's just, and then they want you on something indefinitely. So my goal is to get you healthy enough not to need any of the stuff anymore.
Right.
So.
Yeah. It's always interesting just to see all the, like how it all kind of fits together. Right. And then I do like that, having that Chinese medicine part too, or the emotions, right? Like which organ is impacted with pairing it up with their kind of mental emotional state.
Yeah, that's really big for people. A lot of people never had anyone deal with the emotional aspect of things. So yeah, using the NAT and stuff like that to kind of get down to the emotional part, finding out what it is, where it's coming from, what organ it's connected to. And then from that, I'll often do like a hypnotherapy session while they're doing acupuncture, and then use some of those things from the NAT session into the hypnotherapy session.
Very cool.
Like a little deeper.
Yeah. Let's see. So where can people find you?
I'm on Instagram. It's Holistic Dr. Bright. So Holistic Dr. Bright on Instagram.
Okay.
And also my website is Holistic Dr. Bright.
Okay.
So you can find me there. I do 3 days in the clinic and then 2 days virtually.
Nice.
So a little bit of a mix right now, hybrid. I'm working to get a little bit more virtual here in the next year and focusing more towards all the longevity type of stuff.
Yeah. It's nice to have a balance because people need both, right? We have to still get them ready to be able to do the longevity things.
Yes. Yeah. So I always start with the health optimization portion first, get all your labs, normalized and regular. And then sometimes I'll introduce them to some of the peptides and stuff, and then we'll work into the longevity portion of the whole thing. But yeah, you're not going to live long if you have a lot of mold and metals and stuff like that in your system. So I got to deal with all the basic stuff first. Any of the Crohn's and gut issues and all that. Got people with Crohn's and they're just like, oh, we're just going to scope you. I'm like, well, mostly going to be a pathogen that you can't see with the scopes. Yeah, I don't know. They don't use any of these advanced testing or anything. It's wild.
Oh, and I'm sure you see a lot of it. The parasites in the mold are huge with that. Luckily, we have advanced testing.
Yeah, and even those aren't great with parasites.
Right. The
The
parasites don't show
stool,
up. But
yeah.
we usually work on
I
it.
use more of the muscle testing and stuff for the parasites. They'll show up more. They don't always like to come out. They like to burrow in, and
Yeah.
unless you're on an anti-parasitic or something like that.
They're
Um,
intelligent.
so that's one of the things. And other one be like Lyme or something like that is
Mhm.
also sometimes go dormant and hard to find even on some of these really good tests.
Yes.
So that's where some of the muscle testing comes in, and also helps me narrow down of like what tests they should
Mhm.
get, because these
Yeah.
testing can be very expensive.
For sure.
And so if I could just narrow down, a couple $1,000 and here, just do this test is what's showing up more.
hmm
And that's the other kind of compliment that it helps.
Plus, I think you would see this too. California, generally, our toxin labs are a little bit worse than some other places.
Yeah. It just depends on their profession. I've had like some of the longshoremen and stuff like
Oh,
that.
yeah.
Like, yeah, we need to check you for some heavy metals and
hmm
stuff. And he's like, I was doing lead paint on the boats, all that. So like, yeah, let's check that. The firefighters. So I get a lot of those people too, where I'm like, you just need to run a whole
Yeah.
tox
Full
from
panel.
Brand or something.
Yeah. You need the
It's,
full panel.
yeah. So whether it's the fire station, whether it's,
Yeah.
yeah, they need to get like saunas in all of their stations. And
I wish. Don't you wish we could just
yeah,
outfit them with like binders and
'cause
herbs and
as much as like,
methylated
yeah, we pay
beads?
for all that, like, they can easily get those things in there.
Yeah.
Not that much. But yeah, just the education and stuff of what they could be doing. Some of the glutathione, like oral wellness here, some of the glutathione, I've used that on some nonverbal kids too, which has been great. They start speaking again after a couple months. Just the
Yeah.
glutathione spray
Yeah.
alone, just getting those toxins and stuff out.
Yeah.
Yeah, they can make, for kids especially, make a huge difference.
And it's amazing too because I mean it's coming out there and it's more and more available, but unfortunately, generally those parents have to dig for this information,
Yeah.
right? It's not just from their traditional pediatrician to say
No,
like, oh,
definitely.
take them off food dye and
Yeah.
sugar and gluten, right? And do Feingold diet or whatever it is. At least start with something.
Yeah. And, these amazing moms will go through and do the research if they have to.
Yeah. Oh, and
And
they
a lot of
do.
them end up
Yeah.
learning more than most traditional doctors will ever know about how to reverse some of these issues, because no one's going to care more than you. So,
Right.
yeah, we do need to be our own best advocates. And I
Mhm.
think COVID really showed a lot of people that just don't
Yes.
believe the experts because they're wrong a lot of the time.
Yeah. And
Uh,
the data's old and or possibly
Manipulated.
has some sort of motivation behind
Yeah.
what's being presented.
Yeah. So you definitely have to be your own advocate. Unfortunately, it's not as easy as, just trusting someone. So definitely look into things before you're going to be, putting into your body or anything like that.
And your kid's body or when
And
you're
your kids.
pregnant.
Yeah. And then if they say there's no option, there's nothing we can do, then find another practitioner, another field,
Right.
and get another opinion, because maybe there's nothing they could do in their knowledge in their field. But
Yeah.
maybe you can find an acupuncturist, a naturopath, a chiropractor that might have a different opinion. And you can go see 100 different acupuncturists or
Mhm.
chiropractors, and they're going to do different techniques and different philosophies and things like that too. So, you can go to the joint and see a
Right.
chiropractor, or you can go to like a CPK doc that does all the hand modes and gets
Right.
deep into that stuff, and it'll be a very different experience.
It's true. Yeah. Because how many times have you heard acupuncture doesn't work for me?
Yeah.
Right. Or, oh, I didn't like this chiropractor or whatever it was. And we're all so different and have such unique styles, everything we pulled from, and then all the different teachings that we resonate with.
Some people think they went to their MD and they gave them some narcotics or something like that, and they went one time, but they're still doing the treatment every day by taking the pill.
Exactly.
They expect
Right.
you to go to acupuncture one time and just cure all
For
the
it to work.
pain.
Yeah.
And it's like, well, you taking a pill every day, at least
Mhm.
you can come twice a week or something and see, over a few weeks how that reduces your pain.
Same with
Uh,
the herbs, right?
yeah,
I took that for a week. It didn't work.
yeah,
It's like, it's meant for a little longer.
yeah, yeah. I didn't feel anything. It's an herb. It's not as strong as a drug,
Right.
too. So,
Exactly.
and then why do I have to take 9 of them?
Oh, yeah. The dosing
I
on
guess on an
the,
aspirins, so we have to take a little bit higher dose. Yeah.
yeah.
So, but yeah, the peptides have been really cool. I see them as natural too for a
Mhm.
lot of them.
Yeah.
Kind of like herbs were. So it's kind of like the new, I guess, high tech, natural
Mhm.
thing that's out. Again, gonna have issues with the FDA and all that approval stuff because it's natural.
Right.
So it's gonna lag behind,
Yeah.
far behind.
And
But
they just have to be done properly and safely. That's
they want like billions of dollars of testing and stuff like that, which no one's gonna put forth that can't patent any of the technology too. So
Yep.
stuff.
Well, it's nice that we have a lot of new tools in our
Yeah.
tool belt that aren't just the ancient ones, right?
Right. And So I love this profession. I can get to continue to learn every day of new things and always look forward to something else that's coming out. So
Well, thank you so much for joining us
thanks for having
today.
me.
Of course.
Appreciate it.
All right.
Thanks for listening to the Longevity Leaders podcast. Our Longevity Leaders community is on mission to transform 100 million lives by 2040. If you enjoyed this show, please share this with somebody that you know, especially another doctor or physician, but also click that follow button. Until next time, stay strong and live long.